Hello, I'm Wonsun Park, a professor of pediatrics at Samsung Medical Center, Sungkyunkwan University, Seoul, Korea. Today, my talk is about human phase 1 clinical trial of stem cells for grade 3 to 4 IVH. I'm disclosing that I've been listed as one of the inventors of the patents of stem cell therapy for bronchopulmonary dysplasia and intraventricular hemorrhage. The objective of today's talk is to give you a brief overview of phase 1 clinical trial of mesenchymal stem cell transplantation for severe intraventricular hemorrhage. For this phase 1 clinical trial for IVH, we have used human allogenic umbilical cord blood-derived mesenchymal stem cells manufactured in strict compliance with good manufacturing practice. We tested 2 doses, 5 million cells per kilogram for low doses, 10 million cells per kilogram for high doses, and based on our preclinical data, transplanted intraventricularly at the early time point after detection of severe IVH. For the clinical data of enrolled infants, the total 9 enrolled infants, all diagnosed with grade 4 IVH. First 3 infants received low doses, and the other 6 infants received high doses. Average gestational age was 26 weeks, 24-weeker being the youngest. Average birth weight was 767 grams, 440 grams being the smallest. And MSCs were transplanted at the average postnatal day 12. This is the 24-weeker, 660-gram baby diagnosed with grade 4 IVH. At postnatal day 12, MSCs were transplanted intraventricularly under ultrasound guidance, and no transplantation-related complications were observed immediately after and 1 day after the first year. No dose-limiting toxicity, no adverse drug reaction related to transplantation was observed in none of the 9 enrolled infants. This is the 24-weeker, 660-gram baby with grade 4 IVH. After MSC transplantation at hospital day 12, there were no progress of ventriculomegaly, and periventricular hemorrhage infarct was also significantly attenuated until hospital day 94. However, quite unexpectedly, a very delayed progress of ventricular megaly was observed at hospital day 121. So the baby received shunt surgery and now being discharged home and now being followed up at the outpatient clinic. This is another 24-weeker, 700-gram baby with grade 4 IVH. After MSC transplantation at postnatal day 10, the initial progress of ventriculomegaly was gradually attenuated, and periventricular hemorrhage infarct was also markedly attenuated. So, the baby discharged home without any further treatment at hospital day 101. This is 28-weeker, 730-gram baby with grade 4 IVH. After MSC transplantation at postnatal day 15, there were no progress of ventriculomegaly, and periventricular hemorrhage infarct was also markedly attenuated. So the baby discharged home without any further treatment at hospital day 72. These findings will support safety and feasibility of clinical transplantation of MSCs for IVH. When compared with a historic matched control group with grade 4 IVH, death at discharge was significantly improved with MSC transplantation. However, the seemingly improved less shunt rate, late onset sepsis, ROP requiring surgery, and NEC and seizure, all these parameters did not reach the statistical significance. In conclusion, human umbilical cord blood-derived mesenchymal stem cell transplantation is safe and feasible for the preterm infants and might be a promising new therapeutic modality for treatment of severe IVH. Thanks for your attention.